Da, 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 da. Hey, I think we're on. Hello, everybody. Let me just make sure we're recording, because if you tune into the Love Lab frequently, you know we have a lot of technical difficulties. And yes, we are recording. So welcome to the Love Lab. I'm Dr. Rachel, family medicine physician and clinical sexologist. So a lot of you follow me on Twitter. Some of you just know me, and some of you are probably even some of my patients. So hey, and thanks for joining me every Thursday night, 10 p.m. Central Standard Time. So we got a lot to talk about today, and we only have 15 minutes to do it. So let's dive deep into it. Okay, let me get my interface up here. And, okay, so of course we've got the tweet of the week today. We have to talk about heart disease and heart attacks. One of our favorite reality stars, Tami Roman from Basketball Wives, actually had what her publicist has called is a minor heart attack. So what's a minor heart attack? What's the difference between a minor heart attack and a big heart attack? And how did something like this happen to such a young, a vibrant, full of energy, full of anger 41-year-old? So we got to talk about that. And then the question of the week I'm addressing is anal sex. She direct messaged me the question, and a lot of you do that because some of you don't want everyone all in your business. She direct messaged me a question about anal sex. So even though we visited this before, we're going to tackle it in a different direction and hopefully answer your questions on it. So let's get started right into our tweet of the week. The tweet of the week this week comes from Iva Williams at Unclever. She retweeted, the quickest way to lose access to someone is always accessing them. And then she did the little arrow, y'all better listen. Well, that made the tweet of the week because that's so true. Sometimes less is more, and sometimes more is less. So if you have someone that you're severely interested in, the last thing that you want to do is suffocate them, text messaging them 600 times a day, calling them, and tweeting them to the point where they have no opportunity to miss you or even wonder what you've done today. Because you've told them, I ate breakfast, and then I went to the mall, and then I did this and this and this and that. You're losing if you do that. Every relationship has to start with a little bit of mystery. Mystery maintains passion and sensuality, so keep a little mystery there. Don't overdo it, but don't underdo it either, okay? So I have to talk a little bit about I have to talk a little bit about heart disease. Now, for some of you who don't watch a whole lot of reality TV, there's a program called Basketball Wives that comes on VH1, and it's basically women who were engaged to, dated, or had a baby with a basketball player. And there are some basketball players' wives, but that tends to not be where they're coming from on this. So let me play a little clip, and then we'll talk about Tami and how she ended up having this minor heart attack here.
It's serious. I wasn't trying to be cute. I'm appreciative of situational sex. That's it. What I'm saying is, don't try to be coming at me talking about
Okay, that's
right,
Tami.
No, bitch, that was specific to me. Talking about all the way from food stamps, right, Tammy? Bitch, I know where I came from, but you need to understand where the you came from. So don't let me start telling your bitch. So shut the up and say what you're saying.
Well, as you can see. As you can see, it's a very vibrant program with tons of cussing, tons of arguments. And the problem here is that stress is one of the number one ways that you can have a heart attack. Actually, they've even had people who've had heart attacks just based off of a love lost or just being scared to death. So stress is a number one cause of heart attacks in women. So I want you to think about this. We hear a lot about breast cancer. They talk about breast cancer awareness. We wear the ribbons. But really, heart disease is the number one killer of women in the United States of America, period. So the risk factors include, but are not limited to, family history of heart disease, smoking, if you've had any drug use, which Tami allegedly used to have some drug problems, so that could have weakened her heart too. Just the diet that's racked in high cholesterol, blood pressure problems, and this thing we call metabolic syndrome. Now, if you are like everybody else in the summertime, you maybe have this little bit of an inner tube around here, and you're like, how can I lose that? Well, besides wanting to look cute in a bikini, you really need to think about losing it, because that little area, coupled with high cholesterol, puts you in the category of having metabolic syndrome, and if your blood pressure is a little high too. So metabolic syndrome actually increases the risk that you might have a heart attack or heart disease in the future. And so, you know, if you watch the show, you'll notice Tammy's weight fluctuates up and down, and every time we see her, she's actually eating, and sometimes even eating ranch dressing. We all love ranch. But if you look at the bottle of your favorite ranch, you'll notice that it's loaded with cholesterol, fat, and calories. So we're coupling stress, road rage, being angry, having a poor diet, low exercise capacity, smoking cigarettes, and a past history of drug abuse. And this could happen to any 41-year-old in America. So I caution you all, it seems like around us people are having these heart attacks and you're like, they're so young. Well, at the end of the day, if you don't take care of yourself, these are the types of things that we'll have to look forward to early. So if you start now, we won't have to worry about these things later in life. Now, the headline said she had a minor heart attack. So what is a minor heart attack? Basically, when you have a heart attack, what's really happening is the blood flow to your heart isn't getting there. So however that's happening, it can happen in a small degree, or it can happen in a large degree, meaning that it can be one vessel that's blocked off or a couple vessels that are blocked off. And so at the end of the day, that's how you end up having a heart attack. And what ends up happening is the tissue, muscles need oxygen and blood flow to survive. And when it's not getting the right amount of blood flow, the muscle tissue starts to die and get weak. So if you have high blood pressure, if you have high cholesterol, these are the types of things you need to take very seriously and follow up with your doctor and follow their prescribed diet and their medication regime. So our hearts and prayers are with Tammy as she recovers from this heart attack. And my love and prayers are with you all too, because I want to make sure that we use this as a sign that one, stressful events, having a stressful life and not eating right can actually take you out of here early. Luckily, Tammy's still with us, so we want to keep that momentum going, okay? Now, my question of the week came from a young lady. She direct messaged me. This wasn't something that she wanted to share in public, but her question is, hi, thanks for allowing me to send a direct message. Are there dangers of anal intercourse? I get this question all the time because everybody wants to do it. The guys are watching porn, and you cannot watch a good porn movie without some good old-fashioned anal. So, in an attempt to get out of it, women are always asking me, is it safe? Because a lot of them really don't even want to try it. And, you know, that's understandable. But let's talk about it like this. There's nothing at all wrong with anal sex when it's done correctly, when you take precautions. Unprotected anal sex, if you are the receiver of the penis in your anus, you are at the greatest risk for contracting HIV. That thing alone is very risky. It's riskier than unprotected vaginal sex. So I want you all to be leery of that and make sure that if you're going to allow someone to go into your butt like that, that you make sure that they put a condom on. Because not only will a condom make the process easier, it'll also make it cleaner and it'll make it better. Less friction. So here is my mock anus here. Okay, so think of this tube as your anus or your rectum. Think of this tissue on the inside as your mucosa or the lining of your anus. Now I want to preface this with vaginas and anuses are completely different things. They're two separate things, so do not let anyone treat your anus like it's a vagina because it's not designed to be worked that way. So it's very sensitive, so it's got great nerve endings all around it, and that's why it feels so good if you can tolerate the pressure or the size of whatever's entering it. But I want to caution you, there are some risks when it comes to anal sex. First one, of course, is it's very easy to catch an STD. It's very easy to catch HIV if the person that you're having sex with has one. That's the first thing. Second thing is it's very easy to tear. The anus is not full of elastic tissue like a vagina or a mouth is. It actually tears if it's not relaxed properly. So that's one thing. And if you've listened to any of these before, you know that an area that tears is more sensitive to infection. So you got to be very careful. This is why I recommend condoms. But the other thing is there's no natural lubricant for the anus. There just isn't. And so the only lubricant that you can use is what's on your partner's tool that they're using to penetrate you, any extra lubricant that's available, and the feces or the boo-boo that's actually in there. I'm sorry, yes, that actually is a form of lubricant. But so some of the things that can go wrong is you can actually have an anal prolapse. And what that is if someone's penetrating and they're penetrating rapidly, and before you know it, there's too much friction and the inner part of your anus is kind of hanging out. That's what we call an anal prolapse. And the people who generally get this are people who've had vigorous amounts of anal sex. And that's why I say, don't let anyone use your anus like it's a vagina, okay? The other thing that can happen are the tears that we talked about. That's very important. The other thing is, if it's torn too much, it can actually make it so that you have a hard time holding in your feces or holding in your gas. So after anal sex, you can look forward to this area feeling a little looser. I mean, you're going to have to try to gain control of it. But some ways that you can minimize this is 1, use the condoms, 2, use a lot of lubricant, 3, prepare yourself ahead of time. 4, please don't double dip. No anal penetration then vaginal penetration, or no anal then oral, because what you're doing is you're passing bacteria, because this is feces in here, and E. coli is very strong there. No fingers or anything there and here. No double dipping, so we got to avoid that. And then 2, of all things, you like someone, you've been with them for a long time, please get them tested for HIV, because if you're going to allow someone to penetrate your anus, that is the riskiest form of sex that you can have when it comes to HIV contraction, okay? So I hope I've answered your questions. If you have any more, please hit me up on Facebook or on Twitter. Another question I have here that just came through is, hi, just wondering, is there such a thing as a sex therapist or doctor? Although I have children and have had sex before, I'm not comfortable with it and I need to talk to someone about it. Absolutely. Check in your area. Go to AASECT, AASECT.org. They can direct you to a good sex therapist, or Google sex therapist and your town, and I bet you some will come up. Not only that, but a lot of psychologists are trained in sex therapy. And if you happen to be in the Chicagoland area, you can actually look me up as well. So I hope I've helped. As usual, hit me up with your questions so that we can keep the dialogue flowing. Now, I caution you, please, I've been tweeting more weight loss tips and healthy living tips. You know, I'm a family medicine doctor and a clinical sexologist, so all this stuff swirls together. And I know that a big part of feeling sexy and keeping you and your partner together, or even finding someone that you're comfortable with, is being comfortable with your body and the way that it flows and goes. And on top of that, keeping your family together entails being healthy, cooking great meals so that you guys aren't eating out all the time, losing weight, exercising regularly, because not only will those things help you feel better, but you'll have a longer, healthier life as a result of it, okay? So don't get confused when I'm tweeting about health stuff at one moment and sex stuff at another moment, because to me they all swirl together and I'm an expert in all of them, and it's all just kind of whatever I happen to be thinking about, that's what I tweet about, or unless you give me some guidance and tell me some things that you want to know, okay? So tune in every Thursday, 10 p.m. Central Standard Time, right here on Ustream for our regular chat. So as usual, it's always a pleasure, and look for me on Twitter tomorrow, and when you get a minute, hit me up with some ideas as to what types of things you want to talk about tomorrow, all right? So I look forward to seeing you next week. Bye.